Well, epilepsy affects millions of Americans, but for some, medications alone aren't enough to keep seizures under control.
At MU Healthcare, doctors are using advanced technology and specialized treatments to help patients regain their independence. In today's Focus on Your Health, Meg Judy talks with a neurologist about how their team is providing hope for those living with epilepsy.
Focus on Your Health is sponsored by MU Healthcare.
Epilepsy is more common than many people realize, and for some patients, medications just aren't enough. To help us understand the advanced options MU Healthcare is using to give patients relief, I'm joined by MU Healthcare neurologist Dr. Sean Lanigar. Thanks for being with me.
Thank you for having me.
Some people will have epilepsy for years and years without a diagnosis. How is that?
Well, it's a difficult diagnosis to make. Often we think of seizures as something like, oh, they're shaking, they're unresponsive, they're having generalized shaking. It's not always the case, though. Yes, while that can happen, it can be other things, too. It could be staring with unresponsiveness, periods of loss of time, other odd sensations, weird tastes or smells.
Okay.
And so, again, this can make it difficult to diagnose. This is why it's important to see somebody who focuses on this to make that diagnosis.
So the diagnosis is pretty tricky, but then the treatment options, those can be pretty tricky as well, right?
It can. We classically think of medications for seizures, but that's not always the solution. About 1 in 3 patients will not respond to medication. That's when we start, evaluating you for more advanced care.
And thankfully, you have a lot of options. What are some of those?
We have things like surgical resection. We also have other options like laser interstitial therapy or neuromodulation.
I understand MU Healthcare is home to a level 4 epilepsy center, which is pretty great, and it means that you can care for the most complex diagnoses.
Correct. Level 4 is the highest level of care that we can offer our patients, and it means we offer a comprehensive range of services in treating our epilepsy patients, both medication and surgical.
So talk to me about the 7 Tesla MRI and what that does when you're diagnosing a patient.
So the 7 Tesla MRI is, again, the highest diagnostic type of MRI we have available here in North America. It lets us see things that we might not have seen on previous MRIs. And if we could find something that's abnormal, again, if that matches up with the EEG, that allows us to offer surgical options that we might not be able to offer.
I'm sure you hear some wonderful stories after you've treated patients, be it surgery or stimulation. What are some of the things you hear?
Well, I think, again, seeing them have more independence, able to do more things in their life that they weren't able to do before is, I think, the biggest thing I see. And, being able to do things like in some patients be able to drive when they never been able to drive before.
So what's your message to someone who's been living with epilepsy or seizures for years and years and just hasn't reached out?
It's never too early or too late to reach out. We are a comprehensive center. If you're failing medications, if you fail 2 medications, reach out. We have other options available to treat your epilepsy. And that's what we're here for, to get the best control of your epilepsy possible.
Wonderful. Thanks for being with us and letting us know about all the options MU Healthcare has to offer.
Thank you.
If you or someone you love is living with seizures, don't wait to get evaluated. To learn more about epilepsy treatment and advanced care options at MU Healthcare's Level 4 Epilepsy Center, visit muhealth.org/focusonepilepsy. For Focus on Your Health, I'm Meg Judy.
Focus on Your Health has been sponsored by MU Healthcare.